Hello, everyone. I'm Dr. Marty Ross, and this is Conversations with Marty Ross MD. It's great to see everyone here tonight. This is a new tool that we're using tonight to do the webinar, and so this will be a trial for me to help figure out how it works. But I believe that we're going to have better video quality, and I do believe there is going to be much less chance that you will see my voice drop as we're doing the webinar tonight too. One of the things that you might want to do, you're going to see that with this new webinar tool that is playing actually on a YouTube player, make sure to see me the best that you have taken your video quality that you can set on the right lower hand side of the screen. There should be a cog wheel. If you would click that and make sure that you get it to the highest definition that you can have, I think you'll have a better streaming quality for the webinar tonight too. All right, and then so what I'm going to do, the way that I'm going to do these webinars tonight, and using this new tool, I think it's going to work out okay. What I'd like you to do, if you have a question, is to write it in the chat box, which is over at the right-hand side on the right-hand left lower quadrant. Just go ahead and write it and send it to everyone. I will get through as many of these as I possibly can tonight, okay? And it looks like the way that this works is the most recent text message is added to the top. So we will be starting at the bottom, okay? So the first text message came from, I believe at least that's the way it works. Let me see here. Yeah, that's the way it works. So I want to start with the first question that actually came from Linda Bowman. So to see Linda's question, you're going to need to go all the way down to the bottom of the chat box, okay? So scroll to the bottom and you'll see Linda's question. All right, so hello, Linda. It's good to see you here tonight. Your question is, if I have an MTHFR mutation, is it correct to say that I would not need both the MethylGuard and the Tri-Fortify Orange glutathione? Would you recommend one over the other? Is folate level an accurate measure of how one's methylation pathways are working, or is that not valuable? Hold on, I'm trying to figure out. Bear with me, everyone. I'm trying to see. All right. All right. So Linda, let me look at that question again. I'm trying to figure out how to use this the best way too. Okay. So about your question. So first of all, I want to make sure that everyone's on the same page about what an MTHFR is. So the master detox chemical that is found in all of us is a chemical called glutathione that is used in the liver to take fat-based toxins and to turn them into water-based toxins. And then as water-based toxins, they're moved out into the intestines where we basically poop them out, okay? So that's a downstream product. You can think of it as being all the way down here, all right? Way upstream, way up here, way up here is the conversion as a step where we take folate from our diet and we convert it from an inactive form into an activated form. And the enzyme that governs that is called the methyltetrahydrofolate reductase, or it's called MTHFR. And so some people can have a defect in that enzyme. And when they have a defect in that enzyme, you don't get adequate conversion of diet folate, which is inactive, into an activated folate, okay? So the way that we correct that problem is to actually have a person take the activated folate, and that's something called 5-methyltetrahydrofolate, or 5-MTHF. We also find it beneficial for the person to also take a methylated form of B12. So what I like to use to correct that problem is a product that has both of those in it. And the product I like using is a product made by Thorne called MethylGuard. It happens to have 400 micrograms per pill of methylcobalamin, the methylated B12, and also 400 micrograms per pill of the methylated folate, okay? And you would start at one pill daily for a week, then you'd go up to 2 pills 1 time a day for a week, and then you'd go up to 3 pills, okay? So that's how I like to do it. Now, the reason you build up slowly is that as you start detoxing, as you remove this roadblock of detox, there's a bunch of toxins that were held behind the roadblock that are going to come through. And that can trigger more inflammation due to a group of chemicals called cytokines, okay? So what we want to do is we want to start slowly so we don't trigger all those cytokines that are going to make you feel worse, okay? Now, to the second part of your question, is a folate level an accurate measurement of how one's methylation pathways are doing? No, because the folate we measure is the inactive folate, okay? We don't have a measurement that we do of the 5-methyltetrahydrofolate. Now, one thing we could do is to measure something called homocysteine that will become elevated sometimes when we have this defect, but it's not the most accurate indicator, so I don't recommend doing that, okay? And then let's see, the next part is, do you need both MethylGuard and Trifortify Orange? Everyone, Trifortify Orange is glutathione. So no, you don't. If you're correcting the MTHFR, you do not need also to give glutathione, because by giving the activated folate, that 5-MTHF, and giving methylated B12 that are found in the MethylGuard, you will then be able to produce enough glutathione on your own so that you don't actually need to go ahead and give glutathione separately. Okay, so I want to do a quick screen share here, and this is going to be my first time doing it here tonight. Let's see how this will work out. Okay, so what I want to do, I'm going to show you an article. This is the Treat Lyme book. Okay, this is from our book. And there is an article in here that is, see if I can get this to work. Well, that's not working. Sorry about that, everyone. Let me try this again. Okay, here we are. Okay, so I'm in the search function. Okay, and there is an article in the Treat Lyme book that we have called MTHFR. All right, and so if you later on, I even have to sign into this. Just hold on a minute. Okay, so this is the article here. Okay, take a look at it later, and you'll be able to see the information that I was just talking about. Okay, all right, let me go back here. Okay, so we're back here again. All right, now let's go ahead. I'm going to take the next question. So Linda, thank you for that one. Okay, the next question again, everyone. I'm working from the bottom up on your scroll bar. The next question is by Dawn. And what Dawn's question is, she says, in Stephen Buhner's book, Healing Lyme, he states his core herbal protocol goes well with antibiotic treatment. He says often antibiotics that are not working well with antibiotic treatment. Let's try this again. In Stephen Buhner's book, Healing Lyme, he states that his core herbal protocol goes well with antibiotic treatment. He says often antibiotics that are not working well will begin to work with herbals. Question, I am on 3 antibiotics, Ceftin, Zithromax, and Flagyl, 500 milligrams curcumin daily, and nystatin 1 million daily. Would adding in cat's claw and Japanese knotwood be overkill? My LMD had me on all 3 antibiotics and took me off at 8 weeks, leaving me on curcumin 500 milligrams daily. And then I ended up in a total relapse. I felt dumped and no longer totally trust her because she thought I was an easy fix. This time, the prescription is all 3 antibiotics plus curcumin for 8 weeks after I feel 100% again. Then she plans to post Flagyl for 8 to 10 months. She told me this before with the first run of antibiotics and did not follow through. I hope to to just use Buhner's protocol along with LLMD's antibiotics, but I don't want to damage. Thanks so much for all you are doing with this webinar. Okay. I guess I may go a little bit of a different direction with your question here, Dawn. And that is, so first of all, there's different ways to skin the cat, if you will. And when it comes to treating Lyme, the more poisons you put in the mix, whether it's prescription antibiotics or whether it is herbal antibiotics, there's a greater chance of developing systemic toxicities, okay? So generally, I recommend if you're going to do prescription antibiotics, do prescription antibiotics. Or if you're going to do herbal antibiotics, do the herbal antibiotics, okay? So now regarding Buhner's protocol, cat's claw is basically an herbal antibiotic. Japanese knotweed actually has two components to how it works. One is it helps lower inflammation chemicals made in Lyme called cytokines. Cytokines are what make you feel poorly when you have Lyme. The other thing that it does is it can actually kill germs too. So that is a germ killer too. So I don't think that you necessarily want to be on that, okay? And so, in other words, I don't think you need to do that and to be on the antibiotics that your LLMD is thinking about putting you back on again. And in fact, if you're looking at ways to augment what your LLMD is doing with the prescription antibiotics, I think a better way to go would be to actually use the successful treatment recipe, our Lyme disease protocol that works around and wraps around very nicely with your germ killers, okay? And I think in ways works much better than Buhner does, which is why we came up with it. There's parts that Buhner does not address. So let me go ahead and show you. And I know that my last screen share did not work. I'm hoping this one goes better. Let me try this again. Let's see. So I'm going to start a screen share here. I think I'm going to start a screen share here. Let's see how this goes. All right, let me try that again. I'm not getting this to work the way I want to, everyone. Let me see. All right, let's try this one and see if that will work. No, that's not going to work. Everyone, I'm having a little bit of a technical problem here. Just a minute. I'm going to try to show you the successful treatment recipe if I can find it. Let's try this again. Okay, so let me see if this is going to work for us now. Okay, so this is our successful treatment recipe, everyone. And in here, I have included Dr. Brooke and I have included all the essential steps that you should be doing throughout your Lyme disease treatment to have the best chance of getting well, okay? And let me scroll down here to the bottom. Aha, I see this is working now. Okay, so anyhow, this is the essential successful treatment recipe. Okay, so beyond using antibiotics, there are essential steps that you should do to get well. All right, so if you take a look at this later, you'll see you can follow it. All right, so one of the things you want to do is make sure you're doing things to get sleep. Okay, and there's some herbs that we recommend for it. There's also some prescription medicines. The second thing that you want to make sure you do is to deal with cytokines. You want to lower inflammation chemicals that are made when you have Lyme living in you. Cytokines are good and bad, and we explain it here. On the good side, they help your immune system work better, but on the bad side, they're made in excess in Lyme, and they actually give you all of the problems that you have in Lyme. Your Lyme symptoms are actually excess cytokine symptoms, and they suppress the immune system. So you should be doing something like taking curcumin, 500 milligrams, 3 times a day to lower your cytokines, okay? I would do that instead of the Japanese knotweed that Buhner recommends. Number 3, you want to be on an herb that helps your body deal with stress. And the one that we like is ashwagandha. It's an Ayurvedic East Indian herb. We tell you how to do it here. The 4th thing you ought to be doing in your treatment, and Buhner does not address this adequately, is you need to correct hormone problems. And you can actually figure out if you have hormone problems on your own, and there's steps you can take on your own to actually correct those. You may need the help of a physician to help with thyroid, okay? So down here at the bottom of this section, we tell you how to figure out if you have problems with low adrenals, okay? So you look at the symptoms area. If you have enough of these problems with your adrenals or enough of these problems with your thyroid, you have an adrenal or thyroid problem. 5th thing you want to do is make sure that you are on a good multivitamin. A good multivitamin will help your immune system work better and will help with detox functions as well too, okay? The next thing that you want to do is to make sure that you take care of yeast if they're present. And in this section, we tell you how to look to see if you have too many intestinal yeast, and we tell you herbal and prescription options for what you do. All right. Part 7 is your germ killers. Okay, this is where we talk about how to kill your Lyme infection. You can see the steps here. Number 8 says do some basic detox steps, and we tell you how to do that here. And then part 9, deal with your co-infections, okay? And you can read through the rest of this. Now, the reason I showed this to you, and let me go back here again. Okay, so the reason that I showed that to you is that, again, that's a successful treatment recipe, and basically it goes beyond what Buhner does. Buhner does not do enough to help you. You need to be addressing all of those steps, okay? And we also consider it to be a better protocol to follow than even the Cowden protocol, for instance, all right? So anyhow, Don, I hope that helps you. All right, so let me move on here. Next question is from Heather. Everyone, look at the bottom of your screen, the chat box, okay? That's where you will see the questions, okay? And thank you for bearing with me. I'm learning how to work with this new webinar tool tonight, and I'm still trying to figure out this screen sharing thing. Also, this chat box function where the most recent question is at the bottom is a little bit quirky for me too, but bear with me. I'm trying to figure this out, and we can still hopefully have a good webinar here. All right, Heather asks, can Lyme cause digestive problems and a scratchy throat? The answer, Heather, is yes and yes, okay? Now, let me round that out a little bit. So Lyme can cause a variety, or in Lyme disease, you can have GI problems for a number of reasons. The first one is that the Lyme infection can cause inflammation of the cells that line the intestines. Those cells are needed to create a nice barrier between the inside of the intestines and your bloodstream, okay? So you can kind of think of it this way. There's one layer of cells. That's what my fists are showing here. There's one layer of cells that separates the inside of the intestines from blood vessels that are down here, all right? And they're supposed to touch up against each other tightly, all right? Now, if you happen to have an infection of these cells, all right, like a yeast infection, or sometimes like Lyme, these cells will plump up and pull apart. Now, when they plump up and pull apart, instead of things getting into the blood vessels down here by being absorbed into the cells and pass through, they leak through these gaps and they get into the bloodstream without being filtered adequately, all right? Now, what's supposed to happen, again, you're supposed to have tight cells where they touch up against each other tightly. Things get absorbed into the bloodstream by being taken into a cell, which is a filter, pass through the cell into the blood vessels down here. In between the blood vessels and the cells are a bunch of immune cells, all right? So if you have gaps, what happens is things leak through that normally would not get through, like toxins or whole wheat particles, sometimes dairy, and they hit all these immune cells down here and they inflame them, which causes even more problems with cytokines or toxins or allergic reaction, which makes you worse, okay? So one GI effect that Lyme can do is it can lead to inflammation of the cells lining the intestines, which leads to leaky gut syndrome. That can make it so you have more inflammation triggered by toxins getting through and by food particles getting through that are not digested well enough, and they can cause inflammation, okay? That's one thing. Second thing that happens with Lyme sometimes is that Lyme can infect the nerves, and it infects nerves throughout the body, causing them to not work correctly. The largest part of our nervous system outside of the brain is the intestinal tract, all right? So one of the things that can happen when you have Lyme disease is you can get dysfunction of the intestines, because without adequate nerve function, the intestines will not, in the intestines, you will not have adequate functioning of the muscles that are supposed to squeeze things through the intestines, okay? So there's muscles in the lining of the intestines walls. When they get the correct nerve signals, they squeeze together, pushing things through the intestines, all right? So often you can get dysfunction of the gut, often constipation, for instance. We call that Bell's palsy of the gut, which means that there's an inadequate nerve function of the gut. Okay, so that's another thing that can happen with Lyme, okay? What other kind of problems can you have? GI problems can you have? Well, Lyme can give you nausea sometimes. Lyme can sometimes lead to diarrhea. So there's a whole host of problems that you can get with Lyme disease and the gut, okay? Now, in terms of a scratchy throat, Lyme can sometimes lead to a scratchy throat by causing inflammation of the glands in the back. So your tonsils, for instance, are immune glands. And also a co-infection that can occur in Lyme called Bartonella also can sometimes lead to inflammation as well, too. All right, now I want to show you, because there is I'm going to try to do another screen share. I think I've got this down this time. I want to show you an article that you can take a look at later about the GI system in Lyme, okay? So let me go ahead and do a screen share here again. Okay, so we're back in the Treat Lyme book. Actually, I'm going to the Treat Lyme book. Okay, so here I just clicked on the Treat Lyme book. And there is an article that I want to take a look at. And actually, I think what we'll do is we'll do a search. Well, no, we'll go by chapters. I'm going to go into a chapter in the Treat Lyme book. And this is the chapter on the GI system, where do we have that? Well, where did I put the GI one? Oh, stomach and intestines. There it is. All right. Okay, so this is the chapter on stomach and intestines, okay? And one of the ones that we have is stomach and intestine problems, all right? So if you're looking for solutions to intestinal problems that you might have, like nausea, or burning in the stomach, or diarrhea and abdominal cramps, or constipation that can occur in Lyme, take a look at this article. It's quite a helpful article. It's one that I wrote more recently. We published it up on January 15th, 2015. Okay, so hopefully you can take a look at this later for some ideas about ways to help with whatever intestinal problems that you might be having. All right. All right, so let me go back here. Okay, so I'm done with that screen share. All right, let me go and see what the next question is. So thank you for that question, Heather. Hello, Rita. I see a hi, Dr. Ross here. Hello. He didn't seem to leave a whole question for me, though. Okay, so I'm going to move on. Good to see you here. All right, let me see here where we are. All right, hello, Amber. Okay, so everyone, again, if you're looking to see what questions I'm answering, scroll to the first question in the chat box, which will be all the way at the bottom, and you can see what I'm going through at the same time. Okay, so this next question is from Amber. Do you have an opinion about LDA, low-dose immunotherapy for Lyme? They give you a dose of Lyme, Bart, Bab immunotherapy every 7 weeks, and it's supposed to desensitize the body to different bacterial infections, decreasing autoimmune reaction to the Lyme so you don't have the pain anymore. Thoughts? Amber, I guess I don't know based on what you're doing here, okay? So I have comments, but I'm not sure if I'm going to be answering your question correctly. And this is one I'm not going to answer for you tonight, because there's different ways I can go based on what your true meaning is, and I'm not going to go either way with it, all right? I'm not familiar enough exactly with what you're talking about too, so I'd rather not give a wrong answer and mislead you. So I'm going to go ahead and move on to the next question. Sorry about that. I do get stumped every now and then. Hello, Josephine. I see that you wrote a question here, but I don't see that you left. Or you said I, Dr. Ross, but I don't see you actually left a question. So let me go ahead and move on. All right. Hello, Kelly. Let's see. This is from Kelly Fleming, everyone. Hi, Dr. Ross. My son is being treated for Bartonella with Biaxin, 500 milligrams 2 times a day, weekdays, 3 weeks per month. He also takes Plaquenil 200 milligrams twice a day and Doxy 200 milligrams twice a day with Flagyl 500 milligrams twice a day, weekends only. He's unable to tolerate the Biaxin Monday through Friday, so he takes it Monday, Wednesday, Friday only. Is this okay? Does Plaquenil make antibiotics more effective? Can NT factor be taken with antibiotics and supplements? Is taking 1 a day beneficial? Do you ever recommend proteolytic enzymes in your practice? So Kelly, you've asked a large number of questions in one question, and I'll try to get through as many parts of that as I can. All right. So I guess I need to relook at part of your question here. So as I understand it, he's using Biaxin 500 milligrams 2 times a day, weekdays, three weeks, and then 1 month off, or 1 week off a month. He's also taking Plaquenil, 200 milligrams 2 times a day, and doxycycline 200 milligrams twice a day with Flagyl on weekends only. All right. So so first of all, Biaxin by itself is not an adequate Bartonella treatment. And in a little bit here, I'll do a screen share so you can look and see what I recommend as being adequate Bartonella treatments, okay? But Biaxin by itself would not work. Biaxin in combination with Doxy can work. About 85 to 90% of the time, I call that a tier 2 treatment. Biaxin along with Bactrim, which is a sulfa antibiotic, can work about 90% of the time. I call that a tier 1 treatment. But when you treat Bartonella, in my experience, I don't want to pulse the antibiotics. I don't want to start and stop them. The reason I don't want to start and stop them is Bartonella replicates quickly. And in fact, Bartonella, by some estimates, replicates, grows itself, creates babies every 24 hours, okay? So if you're not on a 2 antibiotic combination, and that's what I think works best, is 2 antibiotics that are tailored to treat Bartonella, and you should be on them both at the same time. On those days that you're not on the 2 of them together, there is a good chance that Bartonella can come back. So I don't like pulsing antibiotics. Now, some of my other colleagues may have a different experience, but I don't find it beneficial. I think you need to be on at least 2 antibiotics at the same time, 7 days a week, okay? That is for the Bartonella part of things, okay? Now, in terms of your Lyme, pulsing antibiotics can work. And using the pulsing regimen, Biaxin, for the number of days that you're doing, Biaxin would treat intracellular Lyme, treat spirochete Lyme. I think that's fine to do. And then being on Flagyl just on the weekends only, I think is a reasonable thing to look at doing too. So I think from a Lyme germ standpoint, I think you're okay, all right? But I don't think this is an adequate treatment for Bartonella, all right? In terms of what Plaquenil does, so Plaquenil, everyone, is an old quinine derivative that was used originally to treat malaria. All right, but we don't find it useful for that anymore. These days, the #1 prescribers actually of of Plaquenil are rheumatologists, okay? Because Plaquenil also works as an anti-inflammatory and is good at decreasing inflammation. So therefore, rheumatologists will use it in inflammatory arthritis conditions, okay? All right, now the reason we use it in Lyme often, I sometimes will use it as part of a Babesia treatment. We use anti-malaria medicines to treat Babesia, the co-infection Babesia, all right? But the other reason that we'll wind up using it in as part of a Lyme treatment is that it lowers acid levels inside of your cells, meaning it makes them less acidic, it makes them more alkaline. And Biaxin and doxycycline and minocycline and zithromax may in part be deactivated by a high acid environment inside the cells, okay? So Plaquenil can help with that. Now, I really only find it to be really helpful with zithromax, and that's because zithromax is an intracellular antibiotic to treat intracellular Lyme, does not work that well. Biaxin, doxycycline, minocycline, on the other hand, tend to be much stronger, and we don't necessarily need to worry about deactivating or changing the acid levels in the cells by using Plaquenil, okay? All right, now, one other thing here. Let's see, do I ever recommend proteolytic enzymes? So I work with enzymes for two reasons. One is if I have somebody that is having digestive problems, I will use enzymes to help with digestion. And to see what I would do with that, take a look at the GI article that I showed everyone earlier tonight, okay? I also will use a specific digestive enzyme called lumbrokinase. Lumbrokinase is a group of enzymes that come from the skin of earthworms. I love this illness, the things that we have to resort to, okay? And lumbrokinase can help break down biofilms. And the way that it does that, biofilms, everyone, are layers of slime that can cover Lyme germs and may block treatment, okay? I only start dealing with going after a biofilm about 6 to 9 months into treatment if I'm getting nowhere. Because even though we know biofilms exist in everybody's Lyme, it's not clear that they block everybody's Lyme's treatments. And in fact, many of the antibiotics can get through the biofilms, okay? And in fact, before we knew there were biofilms, I used to treat Lyme and never do anything about biofilms and would get huge numbers of people well without ever addressing them, all right? But I do believe at about 6 to 9 months into treatment, if you're not getting better, that one of the things we ought to look at doing is to break up biofilms. And one of the things that can do that is lumbrokinase. And the way that that works is biofilms are made up of a sugar slime layer held together by a protein matrix. That protein is a blood clotting protein called fibrin. Lumbrokinase will break that down. Now, many of my colleagues will use other enzymes like serrapeptase or nattokinase or wobezyme. I don't find those to be that useful, to be honest with you. I think the best one to use and the only one you need to use if you decide that you're going to start treating biofilms, and again, I wouldn't even bother treating biofilms until you're about 6 months into treatment. The one I would use is lumbrokinase, okay? And then finally, about the NT factor, everyone, Kelly's writing about NT factor. NT factor is a product that we use to repair nerve coverings and also to improve energy. And what it's made up of is fats that make up the outer membrane of cells, meaning our nerve cells, okay? And it also is made up of fats that make up the outer covering of the energy factories found in our cells called mitochondria. When we have Lyme disease, what can happen is there's too many oxidizing agents that are in us. Those oxidizing agents damage our mitochondria covering, and they also damage our nerve cell coverings and cell coverings. NT factor will rebuild those, okay? And in fact, there's a study that shows NT factor, by using it for 2 months, there are average energy improvements of 40%, and people have, quote unquote, clearer thinking, okay? There's actually research that shows that. But like biofilms, I don't advocate doing mitochondria energy repair until you're about 6 to 9 months into treatment, because often the basic steps you do will take care of it, okay? So I've said a number of things. So Kelly, I don't actually think 1 pill a day is really gonna work that well. It can be taken with antibiotics and supplements, but it should be taken as 3 times a day. And in the first 2 months of using it, it should be taken as 2 pills 3 times a day. And then after that, you would want to decrease it to 1 pill 3 times a day for 4 more months, all right? I'm going to do a screen share, everyone, because I've said a number of things that you should go back and look at later, all right? So let's do this. So we're going to start a screen share. All right, so this is back in the Treat Lyme book. I'm going to do a search. And one of the things I want to look for first is the article we have on NT factor. All right, I kind of breezed over what NT factor is. It's much more complicated than what I talked about, and I would encourage you to come back here and look at this herb and supplement later. It is wonderful at helping decreasing fatigue, helping with cognition, and repairing cell damage, okay? And again, I would look at using it 4 to 6 months into treatment. All right. The other article that I would take a look at, because I mentioned about Bartonella treatment, that I don't think that you're getting an adequate Bartonella treatment, is we have an article in the Kills, in the Treat Lyme book called Kills Bartonella, a brief guide. All right. Take a look at this article later. And you're going to see the various ways that I recommend treating Bartonella. And these are similar to what my partner, Dr. Tara Brooke, recommends as well, too. All right, central to it is doing things to boost the immune system by following our Lyme disease treatment protocol, the successful treatment recipe. All right, and then you also want to use combinations of antibiotics. Again, I find using 2 at a time is the way you want to go. And then remember I said that I didn't see that you were on an adequate treatment, that I thought that I'd break my treatments down into 3 tiers. Tier 1 is the strongest, and that's where you would find that Biaxin, which is clarithromycin and Bactrim that I was talking about, okay? Now, clarithromycin, along with a tetracycline, that's this tier 2 treatment, works about, does not work as well as, oh God, I'm scrolling around here weird. All right, so this tier 2 treatment would include a macrolide, which is your clarithromycin, along with a doxycycline. That can work, but you should be taking them together all of the time, okay? And then finally, I want to show you a chapter that we have that you can come back and look at later, which is what do you do when you can't get better, okay? And it's called Can't Get Better, Do This, all right? And this is where I was talking about what do you do at certain points, okay? So in this chapter, we have articles that talk about the steps you should take at 6 months and beyond if you're not getting better by following the first 11 steps of our successful treatment recipe, okay? And that is one of the things you might want to do is consider treating biofilms. That's what I was talking about doing with the lumbar kinase, all right? The other thing you might want to consider doing is to work on treating and healing damage to your energy factories called mitochondria, all right? So take a look here at the steps you might want to consider doing. We have articles about every one of those down here in this chapter, okay? So for instance, there's the one about powering up with NT factor. There's an article down here about, where are we here? About biofilms, okay? Where we talk about using lumbar kinase as one of the things that you can use for it too, all right? So take a look at this later, all right? Let me go back here. All right, so here we are again, everyone. All right, so Kelly, thank you for that question, and I hope that answered it for you. All right, so again, everyone, I'm taking these questions one at a time, and we're down at the very bottom of your scroll list, and I'm taking a question next from Deborah B, okay? All right, so let's go here, Deborah. Okay, so Deborah, your question, oh, welcome here, by the way. I'm currently being clinically treated for Lyme and Bartonella with doxycycline and levaquin. I was just tested with Fry Labs and found to have a protozoan. What would be your treatment for this? Thanks so much. Okay, so first of all, as I just showed you about Bartonella treatments, one of the tier 1 treatments. One of the treatments I think work best are to use something called a fluoroquinolone, which is your Levaquin, along with a tetracycline, okay? I think you're on a really strong and good treatment for Bartonella, and I actually like that. Now, one of the things you need to be careful about is sometimes Levaquin can give you tendon inflammation and tendon pain. If that happens, it can lead to breakage of those tendons, so you want to be careful if you should get tendonitis to probably get a hold of your doc and consider stopping the Levaquin, all right? And you start thinking about whether you might have tendonitis if you start getting more pain and inflammation specifically around your joints, okay? All right, now in terms of this protozoan, so Dr. Fry, who runs Fry Labs, has this theory that there is a protozoan, I think he calls it FL something, all right? I think his theory is malarkey, for lack of a better way of saying it. I don't think it is a valid theory. I think Dr. Fry is a nice man, but I think he has a theory that is not useful and has not proven to have any benefit in treating people with Lyme disease. I know some of my colleagues still try to do something about it. This so-called protozoan that he is seeing under the microscope is likely a germ that lives even in healthy people, all right? So, secondly, the things that he proposes to do for it are treatments that we would use for Lyme and Babesia and even Bartonella. So if you're treating your Lyme or you're treating your Bartonella, most likely you're doing the things that even Dr. Fry would recommend for his so-called protozoan. And I have not found it helpful to treat it, and I think you would be throwing away your resources if you do anything about it. My recommendation would be that you treat your Lyme and you treat your Bartonella and look at all of the steps, again, that we recommend beyond your germ killers to get well, all right? Everyone, again, follow the first 11 steps in the successful treatment recipe to get well. And to show you how serious I am about that point, I'm going to go back and show it to you again. Yes, I'm going to do another replay of the successful treatment recipe, okay? So that is our Lyme disease treatment guidelines. All right, everyone, you will probably have a hard time getting well unless you follow these steps, or it's going to take you a lot longer to get there, okay? So again, the key steps you should do in any treatment is get sleep, all right? You want to get 7 to 9 hours of sleep. Number 2, knock cytokines down. Be sure you're taking curcumin, all right, like we recommend here. Number 3, be on a good adaptogen. Use ashwagandha. Number 4, correct hormone problems. And some of these you can do on your own, okay? We tell you, again, in this article, we tell you how to figure out if you have low hormones. Number 5, correct your micronutrient problems. Number 6, get yeast out if they're there. We tell you how to figure it out here. Number 7, treat your Lyme infection. Number 8, make sure you're detoxifying. Number 9, deal with your co-infections. Number 10, do additional medicines if you need to based upon other problems you have. Number 11, do some basic, easy exercise, okay? These steps are critical to your recovery, which is why I just went back through them again, all right? Let me go back here. Okay, so that's it with the screen sharing there. Deborah, I hope you don't feel I'm beating it into the ground, but before you waste money going after protozoan, make sure you do all of those other essential steps that I was just telling you about. And if you're doing those and you're 6 to 9 months into the treatment, then look at the chapter I had just previously shown everyone about that is about what to do when your treatment is blocked at 6 months and beyond. That's our chapter called Can't Get Better, Do This, okay? All right, now I'm going to quickly show everyone one thing. I'm going to do another screen share, and I just want to make a point for everyone to see here. And I'm only going to show this once, so let me go back here again. Okay, so Dr. Terabrook and I, in having our, actually, hold on here just a minute. Okay, so often I am asked, what supplements do we recommend? Which ones are the safest and which ones have the most active ingredients? You've got to be careful with supplements because there's many products out there that use fillers artificial ingredients that are not healthy, could harm a person with Lyme. You want to make sure that you're using products that have the least chance of doing that, that use as much as possible. Don't use fillers, or if they're using fillers, are with substances that are safe, okay? You also want to use supplements that have been sourced for sources that have the most active ingredients, all right? And so I want to just recommend that you take a look at what we have at our supplement site. It's called Marty Ross MD and Tara Brooke ND supplements. For any supplements we recommend in the Treat Lyme book, or within our free treatment guidelines, we have hand-picked what we consider to be the safest, and those supplements that we think give you the greatest chance of improving, okay? In fact, there's been studies done about supplements sold through supplement stores, the grocery store, Whole Foods, places like that. The majority of stuff that they have on the shelves actually, when we look at their active ingredients, they don't even have the necessary active ingredients that they say they do, all right? So don't waste your money. Make sure if you're going to try some of the stuff we recommend that you give the best chance, and you might want to take a look at the recommended products that we have here at our supplement store, all right? All right, let me go back here again, everyone. Okay, so that is the only plug you will hear me do tonight for our store. And again, you don't even necessarily need to buy from us, although that would be great. But make sure you take a look at what we recommend, because that's going to give you the best chance for your recovery. Okay, all right, let me go back here. So Deborah, I hope that answers your question. Let me move on here. Hello, Joy. Let's see. Hello, Dr. Ross. Have you encountered pseudotumor cerebri as a diagnosis secondary to Lyme? I have lost approximately 77% of my vision, hopefully temporarily, and am, let's see, and I'm struggling with decision of how long to give the antibiotics to work before I break down and have the surgery to save my vision. The shunt stents seem to be risky, but I have been on antibiotics since October with no improvement yet. How would you have treated pseudotumor cerebri? Thank you. All right, everyone. So pseudotumor cerebri is a condition of the brain where there is elevated pressure in the spinal fluid of the brain that can give visual disturbances. It can cause a pressure around the brain and also pressure around the optic nerve, the eye nerve, okay? So, Joy, I have not seen this to occur in Lyme. I'm not aware that my colleagues necessarily have seen it either. But the one thing I do want to let you know is that Lyme triggers inflammation. It triggers inflammation all over the body. And it could have triggered inflammation of the channels through which your spinal fluid flows. There's an area where the back of the brain, where the spinal chambers connect with the spinal fluid area of the spine, there's a narrow opening through which that spinal fluid needs to flow. If there's inflammation around that, it could be inflamed and actually block the flow of spinal fluid between the brain and the spinal cord. And so that can lead to that increased pressure, okay? Now, I have not seen it specifically happen in Lyme, but it is very possible it could be part of Lyme. In terms of treatment, go after your Lyme would be one of the things. But if you're at a point that you're starting to have injury to that nerve root, temporarily at least, you might want to do the procedure to take the pressure off while you get Lyme under control, and hopefully long term, then are not going to need, will have decreasing pressure in the brain by getting the inflammation around the channel through which that flows to go away, okay? But temporarily, you may need to do that shunt if Lyme is causing the problem. And again, I have no proof that it is or is not based upon what you've just said, all right? So let me go ahead and move on here. Let me see. Okay, thank you for that question, Joy. Alicia, hello. Let's see. Any information you can give on successful Protozoa rheumatica treatment? Okay, Alicia, I think I answered that question earlier. I think that this protozoan is a hoax. I don't think it is a real illness, and I would focus more on treating Lyme, treating Bartonella if it's there, treating Babesia if it's there, and doing all the steps that I recommend, Dr. Brooke and I recommend in the successful treatment recipe, okay? All right. Cami, hello. Thank you for saying hello. I don't see that you left a question, though. Let me go ahead and keep moving on. Charlotte, how are you? I think I haven't seen you here before. At least I don't recognize your name. It's good to have you here tonight. Let's see, are you familiar with problems with mutations in methylation? I received a report today from Dr. Amy Yasko, and I'm concerned that these issues could prevent my progress. All right. So, Charlotte, earlier tonight, I did talk about a type of methylation problem called an MTHFR defect. That may be what your doctor is talking about. The simple steps to take if you have that would be to be on a supplement called MethylGuard made by Thorne that has an activated folate in it called 5-methyl-tetrahydrofolate, and also has another product in it called methylcobalamin. I already showed everyone tonight earlier an article that you can read on the Treat Lyme book called MTHFR and Detox, a Lyme bite. Take a look at that later on your own. I'm not going to go back through the answer to that question again, but later you could go, if you were not part of the webinar earlier when that question was asked, at the end of the webinar tonight, go to our main website, www.treatlyme.net, and look up in the Treat Lyme book that article called MTHFR and Detox, okay? All right, let me move on here. Hello, Rita. Let's see. I am on artemisinin for Babesia. Should I get periodic blood work while I am on this? Lab work like hemoglobin and liver function test. Okay. So everyone, Rita is taking artemisinin. Artemisinin is also known as Chinese wormwood. And it is quite successful actually at getting Babesia out. It works about 75 to 80% of the time. I put it in what I call my Babesia Tier 2 treatments. I'll show you what the Tier 1 treatments are here in a minute. I have a whole article that I have written called Kills Babesia, a brief guide, okay? But artemisinin can work well about 75 to 80% of the time. When you use it, I like to use it as a 100 milligram pill. And I like to use it fairly aggressively 3 days in a row, and then you take 11 days off. The reason you would want to take off for 11 days is that the intestines actually develop an enzyme that can deactivate it. So what we do is the days that you take it, you wind up taking it really whopping doses, okay? And so the way that I'll have people take it is 100 milligrams, 3 pills 3 times a day, and they do that for 3 days. It can sometimes make you feel worse for up to 5 days from when you take that first pill. And feeling worse might be you get air hunger, you might get more sweat, you might get more fatigued, okay? But if that worsening is not too bad, when you do it again, beginning 2 weeks after you take the first pill, so in your second round, you would go up to 4 of the 100 milligram pills 3 times a day for 3 days in a row, then 11 days off. And again, if you tolerate that fairly well, then you would go up to 5 of those 100 milligram pills 3 times a day for 3 days on, and then 11 days off, and you just keep taking it that way. Now, an average Babesia treatment length is going to be about 5 months, okay? 4 to 5 months, takes that long, all right? We want to treat at least longer than the life cycle of one of red blood cells. Red blood cells, when they're made in the bone marrow, will actually live about 3, maybe 4 months. We want to make sure that we bathe the new blood cells coming up with their anti-Babesia medicine so they don't get reseeded, impregnated, if you will, by Babesia, okay? So that's why we treat that long. That's when we have the best chance of actually getting rid of Babesia, all right? So, anyhow, in terms of getting blood, the reason you take 11 days off is during that 11 days, everyone, the enzyme that is made that can deactivate the artemisinin will go away. All right, so that's why you wait that amount of time. In terms of blood work, what I would probably do is get a complete blood count after you've been on the artemisinin for a month, and I might do your liver test and also kidney testing maybe 1 month after you start the artemisinin. If you're doing okay, then maybe once every 2 months, okay? And that's pretty much is how I do testing during Lyme, is when I make a new change, I might do a test maybe 1 or 2 months later, and then about every 2 months after that, I will wind up doing testing to see the bone marrow is holding up by getting a blood count, and also do kidney and liver testing as well too, okay? All right, so I hope that answers your question. I'm going to do a quick screen share here again, everyone. Let's see. All right, so here we are back in the Treat Lyme book again. Actually, no, we're in the Successful Treatment Recipe, our Lyme disease treatment guidelines. So I want to go back to the Treat Lyme book, and I'm going to go, one of the ways that you can get through the Treat Lyme book is to use our chapters navigation function, okay? So I'm in one of our chapters section here, and this is the table of contents for our chapters. And in terms of how do we treat things, I'm going to look under our chapter called the Anti-Germs, Prescriptions and Herbs, okay? And in here, we should have an article on killing Babesia. Where are we here? There it is. Kills Babesia, a brief guide, okay? So take a look at this later, but you'll see that I say the best way to treat Babesia is to use combination of antibiotics, but you want to make sure you're doing all of the steps in the successful treatment recipe. I know you've heard me mention that a few times tonight, but you need to give yourself the best chance to get over Lyme. You need to do more than germ poisoning, okay? You need to support your body and correct all the abnormalities created by Lyme. And that's what we do in the successful treatment recipe. Again, we find it to work better than Buhner herbs. We find it to work better than the Cowden protocol, okay? So anyhow, take a look there. All right, so we use combinations, all right? So I break my treatments down into tier 1. These are Babesia treatments that work about 85% of the time. And you'll see what I mentioned here. And then within tier 2, these work about 75 to 80% of the time. You'll find the information that I have that we recommend on artemisinin, okay? You'll also see in here another herb that you can use called Cryptolepis, all right? That's another herb that seems to work about 75% of the time. I still prefer, if I'm going to go herbally though, working with the artemisinin. I just have more success, a greater track record of working with that one, okay? All right, let's see here. Let me go back. All right, so here we are. So let me go ahead and take the next question. All right, so thank you, Rita, for that question. All right, let's see. The next question is from Katrin. So Katrin wants to know my thoughts on cryptopyroluria. I always stumble on that one. So it is a medical condition that can also be a contributing factor to Lyme. What I do, I never really even test for it. What I recommend is that to deal with it, you need to be on various minerals and nutrients, okay? And so what I do in my practice, I don't test for it. I just make sure that everyone is on a good multivitamin. The ones that I like using, which would have anything in it that you need to deal with cryptopyluria, would be to be on vitamin powders that are either made by Thorne or Integrative Therapeutics. The one I like from Integrative Therapeutics is a powder compound called the Energy Infusion, 1 scoop 1 time a day. Or I like using a product made by Thorne if you should have drug sensitivities or allergies, and that Thorne product is something called Metaclear, okay? And if you're to do that, you'd want to do 1 scoop twice a day, all right? So that's what I would look to do with that. Katrin, thank you for your question. Hello, Becky. Another pregnancy question. Well, I welcome pregnancy questions. My daughter has Lyme, but doesn't have enough symptoms to warrant Lyme treatment because their immune system is keeping it at bay. Would she still need to be on an antibiotic to prevent passing it to the fetus? Okay, so So in terms, if a person has a Lyme infection in them, but maybe doesn't have Lyme disease, okay, so let me tell you what I mean by that. So I believe that Lyme can live in a person and it may not cause any problems, that either their immune systems get rid of it, but they still make antibodies, which we would see by having a positive Western blot, okay, or their immune systems deal with it, they keep it under control. Just because we have an infection in us does not mean we get disease, does not mean we get the mess created if Lyme cannot be kept under control, okay? It's just like we have bacteria that live in our skin, but most of the time we don't get skin infections because our immune system, the defenses we have in our bodies, keep those germs under control. And for many of us, our immune systems work well enough that we can keep Lyme infection under control if it's in us, okay? So I do not always advocate treating somebody that has Lyme infection if they don't have Lyme disease, all right? So what is Lyme disease? Well, Lyme disease is the mess that gets created if the Lyme infection is not kept under control. But if a person is healthy and they have Lyme infection, I would not treat. And the reason I don't treat is that we have no endpoint. We don't know how long to treat. In addition, even if a person has Lyme for a year or more and we start treating, the chances are we're never going to get rid of the germ anyhow, all right? And that the best we're doing with antibiotics in somebody that has Lyme for over a year is we're keeping the germ under control, all right? Now, if we use antibiotics haphazardly, when somebody doesn't have symptoms, there is the possibility that using antibiotics could trigger a more virulent, a stronger form of the germ that then leads to disease, okay? Now, that doesn't mean we don't use antibiotics for Lyme. If somebody's Lyme is causing disease, then the risk of using antibiotics is greater than the risk of using antibiotics is outweighed by the risk of staying ill and not using those antibiotics, all right? Okay, so now back to your daughter. So one of the things I do when somebody has a Lyme infection, whether we've treated them and they've gotten completely well, but I still think the germ is in them, or they have Lyme infection and they're doing fairly well, is I do recommend that during pregnancy they take an antibiotic to prevent transmission. So what we know about Lyme in pregnancy is there is good research that shows there's a transmission rate of about 24-25%. Let me rephrase that. There's research, I wouldn't call it good. There have not been enough truly designed research projects that were designed as research that actually have looked at the question of Lyme in pregnancy. But of the small numbers of women that have been looked at during pregnancy, the research would suggest about 25%. There have been pregnancy registries kept where these were not formally designed research projects, but where information was kept about women that have Lyme. There was a registry kept out on the East Coast, late 80s and early 90s, where women were followed, and those that had Lyme that were not on an antibiotic during pregnancy, there is a 50% risk that they would transmit Lyme to their baby, okay? So there's a 50% transmission rate, all right? However, if those women were on an antibiotic during pregnancy, the transmission rate in the pregnancy registry went to 0%, all right? Now, I hardly believe anything in medicine carries a 0% risk, okay? But at least nearly 0%, all right? So usually what I recommend is that if a woman wants to get pregnant, I think she should. I just think she needs to do things to protect the baby from having it transmitted, all right? And that she should take one of 3 or 4 different antibiotics, either Ceftin, or an antibiotic called amoxicillin, or another one called Ceftonir, or another one called Zithromax. Any one of those by itself will prevent the spread of Lyme, okay? The other thing you should know about a woman in pregnancy is that her health may actually do better during pregnancy. That's one of the great things about pregnancy. In fact, I have a patient of mine that has chronic Lyme that likes to get pregnant because she does better when she gets pregnant, okay? She's told me she wishes she could just stay pregnant. Now, I don't know if that's practical, obviously, and I'm not sure everyone out there would have the same feeling. But what happens during pregnancy is that inflammation goes down. Your body, a woman's body, is designed to decrease inflammation to protect that growing baby, okay? And during pregnancy, inflammation goes down, so a woman will often feel better. After pregnancy, however, there is a risk that Lyme can get more active. So you should be aware of that. She should be aware of that, okay? All right, so anyhow, yeah, I hope that answers your question. Now, just so you know, there is an article that I have about this. I'm going to just do a quick screen share. If you want to come back later and take a look at this, the article we have, let me go to the search function here. All right, so back on our search page. I think it's called Lyme and Pregnancy. There it is, Lyme and Pregnancy. Will my baby get it? What about my health? Okay, so this is the article. Take a look at it later. You're going to see answers. You're going to talk about the research basis behind what I just said. And I also talk about what happens to the mother during pregnancy. And then I talk about what to do. I talk about in this article about what to do with an infant or child whose mother had Lyme disease during pregnancy. Should that baby be tested or not? Should that baby be treated or not? Take a look here. You'll see what I recommend on that as well too. All right. So I hope you have found that useful. Again, this is an article within the Treat Lyme book. Okay. All right. Let me go back here again. All right, so here we are again. Let's see, where are we here? All right, Beggy, thank you for that question. All right, oh, I should have told everyone earlier, this webinar is being recorded. It's actually being recorded directly into YouTube, which is why on your screen, you're seeing the YouTube screen, okay? And I will share the link with you tomorrow with that. Through our email. Now, the only way it's going to get to you, I just have to let you know this. When you all enrolled for the webinar tonight, one of the things you would have gotten is a request from me, and I believe Tara Brooke as well too, and MailChimp. It would have asked you to verify your email address, okay? So you may want to go back and make sure you verified your email address, because the only way I'm going to be able to send you emails about the webinar tomorrow is if you signed up to be part of our Conversations with Marty Ross MD email list that you would have been added to when you signed up for this webinar, but you have to approve it, okay? You have to opt in, if you will. So make sure you did that so you can get the email from me tomorrow, okay? Now, if you did not do that, the other thing you can do tomorrow morning sometime, you can go to our webinars recording page and you'll see that I have put up the webinar recording, all right? But if you want to get emails about this, including anything else I might say about the webinar tonight, you will need to go ahead and opt in to our MailChimp account. And when you signed up, so sometime in the last 7 days when you signed up for this webinar, go back to make sure that you actually did opt in, that you did agree that you opted into our email list. Otherwise, you're not going to get the webinar, a link to the webinar recording through your email, okay? All right, hello, David. Have you had any experience with silver hydrosol for Lyme? The answer is no, I have not. Now, silver, so there's colloidal silver, which is very small particles of silver. Silver can kill Lyme, okay? I don't think it works as effectively as prescription antibiotics. I do not think that it works as effectively as the herbs Banderol or the herbal products Banderol and Cemento. Banderol is Otoba bark extract, everyone. Cemento is cat's claw. Those two herbs work as well as any prescription antibiotic combination. Those two herbs treat Lyme 85 to 90% of the time, and those two herbs remove biofilms. It is my favorite way herbally of treating Lyme, and it's the type of treatment you can do on your own, even if you can't find a Lyme literate medical doctor to treat you, okay? So that is Otoba bark extract and cat's claw, okay? Those two herbs, we talk about them in our successful treatment recipe, which is our Lyme disease treatment protocol. You'll also find them recommended in our article called Kills Lyme Germs, a Brief Antibiotic Guide, all right? I don't put colloidal silver in there though, David. I don't find it to work as well as the prescription antibiotic combinations or the Banderol Cemento combination I just talked about. The other thing is there is a toxicity issue you have to worry about, and that is with silver. There is a problem with silver in that you have a lifetime maximum you can get. And if you get too much silver in your lifetime, you will turn blue. Yes, I said blue. People that get too much silver, their skin takes on a blue hue, okay, or a blue coloration, all right? So I don't like using it. There's too much risk involved in using it, okay? All right, thanks for that question, David, and good luck to you. All right, let's see here. All right, so I'm at Renee Tarula's question. And again, everyone, I'm working on these questions from the bottom of the chat box because those are the people that posted first, okay? Let's see, can you tell me everything you know about ropeworms and why you think we have them now? All right, so Renee, ropeworms are a type of parasite that for some reason has become the current germ of the day, okay? The it germ, all right, or the it thing that we should treat. I've been doing Lyme treatment long enough, and I know many of my colleagues that have treated Lyme would be saying the same thing, that we go through phases where there are certain it treatments and certain it germs that become the thing of the day. The current it treatment of the day is volatile oils. People I know are using a lot of oils, and I know they can get benefit, but that's the current buzz, all right? The it thing of about 6 months ago was CBD oil or marijuana oil. And one of the it things now is parasites, specifically ropeworm parasite, all right? But let me talk more broadly about parasites. So parasites, there's many kinds that we can have, of which ropeworm is one kind of parasite. Parasites live in our intestines. They can sometimes cause intestinal problems like gasiness and bloating, constipation, difficulty gaining weight, or just general GI dysfunction, okay? If I have somebody and I'm treating their Lyme and they have any kind of GI dysfunction, I am going to consider treating them for parasites, even without doing specific stool studies of their parasites, without necessarily doing stool cultures of their parasites, okay? Other people that I might think about treating parasites, even if they don't have symptoms, would be people that have lived on well water before as their major source of water, or people that have done a lot of international travel into areas that are not as developed, like into Peru or Panama, for instance, or into areas where the water supply might be contaminated with parasites, all right? So what can happen with parasites is they can live in our intestines. They're actually hard to see. If you were to send a stool sample off to a lab, they have a hard time seeing it, all right? So I think about treating them for parasites, just giving something for parasites, not doing stool studies in somebody that has done a lot of international travel or lived with well water or has a lot of GI symptoms, but only GI symptoms that do not get better if I first treat yeast, okay? So I'm only gonna worry about treating parasites in somebody that has GI symptoms if I first take the steps to treat for intestinal yeast overgrowth. And if they don't have intestinal yeast overgrowth, or if treating for too many yeast in the intestines does not help the gut function, then I'm gonna treat for yeast, okay? I'm sorry, for parasites, okay? So when am I gonna treat for parasites? If treating yeast doesn't make GI symptoms get better, I'm gonna treat for parasites. Or if I've got a person that has done a lot of international travel, I'm gonna treat for parasites, all right? So what do I use to treat for parasites? Well, there's a drug that kind of is a universal, kills everything parasite medicine. It's called Alinea. It's a 500 milligram pill. I have people take it as one pill 2 times a day. I usually use it for 3 weeks. The difficulty with it is it's quite expensive, and often insurance will not cover it for that reason. Here in the States, it can run almost $1,200 actually. So that is quite expensive, as you can gather, okay? The other thing though that you can use besides that is a medicine that's designed to treat flukes, which is called biltricide. A fluke is an intestinal is a parasite of the liver, actually. All right. So the way you use a Beltricide, it's a 600 milligram pill, one pill 3 times a day for 3 days in a row, and then take it for an additional 3 days, one pill 3 times a day, beginning 21 days from when you take the first pill. Okay, so that's how you would wind up using it. I use it as a second choice. It works fairly well, but I don't find it to work quite as well as what the Alinea does. All right, so let me do a quick screen share here. All right, so here's a screen share. I'm gonna just do a quick look. There is an article that we have about parasites. Okay, it's called Kills Parasites, a Brief Guide. You can take a look at this later. It is one of the articles in the Treat Lyme book, okay? All right, so that is that article. All right, now, let me go back here. Where are we? Okay, so next question is from Renee. Hi, Renee. Can you tell me? Oh, I just answered that. Sorry about that. I hope that answers your question, Renee. All right, Virginia. Let's see. I was just recently discovered that I have the A1298C mutation. That's an MTHFR genetic defect, everyone. The lab test was from December 2013. My question is regarding using glutathione injection to support detox while taking MethylGuard. Virginia, I think I answered that earlier tonight. Either it was your question or somebody else's. I don't think you need to use glutathione as long as you're taking the MethylGuard that I recommend for treating the MTHFR defect. If you were not here earlier tonight, take a listen later. Or actually, if you did not get this, you're not part of our full webinar, listen to the recording tomorrow. At the beginning of it is where I talk about the MTHFR defect. Or you can go and read later on our Treat Lyme book, the article we have on MTHFR and detox, okay? All right, so let me move on here. Hello, Nancy. Let's see, is there any significance of vitamin D25, D125 ratio in terms of Lyme diagnosis? If so, can you explain? Okay, so let me see if I got this straight. Okay, so vitamin D25 is good vitamin D, okay? And we need to have adequate levels of it to help our immune system work well. I am not going to remember this theory well enough, but there is a physician or a PhD named Trevor Marshall that has come up with something called the Marshall Protocol. And in the Marshall Protocol, I believe that it's that you have too much vitamin D125, which indicates inflammation. If you have too much of that relative to your vitamin D25, that indicates that there is infection and that you should be doing things to lower your vitamin D levels, okay? So the Marshall Protocol says to limit vitamin D, that it makes it hard to treat your germs, all right? Now, I flat out disagree with Dr. Marshall. And in fact, I've tried the Marshall Protocol, which involves limiting vitamin D and working with small doses of antibiotics, and I don't find it actually helpful for Lyme disease, all right? I just want you to know that. And in fact, you should be on good levels of vitamin D. There's good information that shows that adequate levels of vitamin D25 can be antimicrobial. They actually help kill germs, okay, which is good, and they help your immune system work better. And vitamin D also is a prohormone. It helps the hormonal systems work better in the body too. So I don't focus on that ratio, Nancy, but as I remember it when I used to work with the Marshall Protocol, you would have greatly increased levels of vitamin D125 showing that you have infection, and therefore Dr. Marshall would say stop all vitamin D. I just don't think it's a good thing to do. All right? Thank you for that question, Nancy. Heather wants to know, can Lyme cause low stomach acid? Heather, I'm not sure that it does. So I guess I would say I don't know, but I don't think that it does. Thank you for that question. Hello, Josephine. Let's see here. One of my symptoms is that I've had almost no dream recall for several years. Recently, I read that this is the #1 symptom of cryptopyluria. Pylorrhea. I was stumbling on that one, everyone. Then I read that Dr. Klinghardt thinks that Lyme may trigger this. What do you think about this? Thank you. All right, so I answered my question earlier. So earlier, I answered a question about this condition, and whether Lyme triggers it or whether it exists or not. The best thing to do, I believe, when you're on a Lyme disease treatment is just work to deal with it if it's there. And because the things I'm going to do in the way, I believe that everyone in Lyme should be on a good multivitamin. The multivitamin I recommend, which is the Energy Infusion made by Integrative Therapeutics, or a product made by Thorne called Metaclear, the nutrients that are in there will deal with a KPU. Okay, so that's my answer to that one. All right, thanks, Josephine. Let's see, Deborah B. Marty, have you heard of the PK protocol by Body Bio? An oral phosphatidylcholine mix, oral membrane stabilizing therapy. I have peripheral neuropathy. All right, so I am not, Deborah, I'm not aware specifically of a PK protocol, all right? But let me talk about nerve covering and nerve cell damage, all right? So every one of our cells in our bodies have cell coverings, and a cell covering, whether it's a nerve cell, whether it's an intestine cell, every one of our cells has a layer of fat, and that fat is made up of, or the cell membrane is made up of 2 layers of what are called phospholipids, all right? And that can get damaged, and specifically, especially in nerve cells, that can really get damaged. Now, those same phospholipids, which are called phosphatidylserine and phosphatidylcholine, are also found in the covering of our energy factories in our cells called mitochondria. In Lyme, either due to the direct effect of infection on cell coverings like your nerve cells, or because there is an overproduction of oxidizing agents by the immune system and as byproducts of infection, you get injury to nerve membrane covering, the phospholipid covering, and you can get injury to the mitochondria energy factory covering, and therefore you don't get adequate energy generation inside the mitochondria, okay? So you can repair that. Now, I don't know what this mix is under the KP protocol. What I do know that works, though, is what is found in NT factor, and I was talking about that earlier tonight. I'm going to go ahead and just do a quick screen share so I can show you that again. The reason I want to show this to you is the picture that we have as part of it actually shows you this biphospholipid layer that I was telling you about. So let me just do a quick screen search here. Okay, so this is for NT factor. All right, so NT factor phospholipids is made up of has phosphatidylcholine as well as a phosphatidylserine in it, okay? All right, so I'm just gonna circle it here. These fats are what make up a cell membrane, all right? And it's called a phospholipid bilayer. There literally are 2 layers of fat. I'm running my cursor through one level, and then here is the other level. I'm running my cursor through that right now too, okay? All right? And so that's the bilayer, and that's what you can repair with the NT factor, all right? Okay, let me go back here. Okay, so I'm back here again. So, Deborah, I hope that answers your question. If you're going to do the NT factor, 2 pills 3 times a day, and you want to do that for 2 months, and then you decrease it down to 1 pill 3 times a day after that, okay? Again, there's research that shows it's useful for recovering energy because you repair your energy factories, and in fact, 50% of the time, when people use it for 2 months, there are average energy improvements of 40%, according to one study. And there are other studies that show that people have clearer thinking. That's what they study, clearer thinking when they use the NT factor. All right? All right. Thank you for that question, Deborah. All right. Everyone, that is it for me tonight. Thank you for bearing with me as I use our new webinar system. I actually kind of like it. I wish that there was one thing that I could differently, though, and that is flip this chat box so that the top is at the bottom and the bottom is at the top. I may have to look and see if there's a way that I can do that for next week's webinar. But it was good seeing all of you here. We had a good-sized crowd tonight. I think you're going to see tomorrow much better video quality when we get the recording to you, and it will be, I will have it posted in the morning on our webinar recording page at treatlyme.net. Yeah, so in a minute here, I'm going to try to, when we leave, I'm going to see if I can have you, if we can go to our Treat Lyme site, okay? If I'm not able to get you there, because I may not be doing this correctly, at the end, if you want to go back to look at the articles that we have, you would go to www.treatlyme.net and then to the Treat Lyme book. I'd appreciate it if you have not done so yet, if you would subscribe to our Treat Lyme book. And you would do that if you happen to try to reach one of our articles and you need to subscribe to see it, subscribe. You'll find that it's really good information. And when you do so, you're helping to support the work we're doing. I'd like to take more time to grow the Treat Lyme book. I think you can see by my explanations here tonight that I give very practical information. And that's what Dr. Brooke and I do in the Treat Lyme book too. Please help support the work that we're doing so that we can grow the efforts that we have here too. All right? And I hope you all will join me next week. Tomorrow, if you do confirm your email address through our email system, through MailChimp, again, you need to confirm your email address. If you have done that, you'll get an email from me that also includes a link on how to sign up for next week's webinar. Otherwise, you can do that directly on our treatlyme.net site as well, too. All right. Good to be with you here tonight, everyone. Take care, and I hope to see you next week. Okay, bye-bye.